Hi everyone, welcome to MBBS in Minutes. My name is Yash Verma, a first year MBBS student, and today we are going to simplify the cardiac cycle. So let's get started. So first I'll draw a cardiac cycle so that I can give you an overview about the topic. So I'll draw two circles, the outer one for ventricular activity and the inner one for atrial activity. I have divided it into 8 segments. This red one is for atrial systole or atrial contraction, and the yellow one is for ventricular systole or ventricular contraction. So this outer one is for ventricular activity and the inner one is for atrial activity. Let me write, this red one is for atrial contraction and this yellow one is for ventricular contraction. I am writing outside the diagram. So now I'll draw ECG also so that I can give you an overview about cardiac cycle with respect to ECG also. This is P wave, QRS complex, and this is T wave. One ECG denotes one cardiac cycle. Two ECGs denote two cardiac cycle. Likewise, three ECGs denote three cardiac cycles and four for four cardiac cycles. Now we'll talk about the events of cardiac cycle. There are majorly two events, ventricular systole and ventricular diastole. Ventricular systole is of 0.3 seconds and ventricular diastole is of zero point 0.5 seconds. Now first we'll discuss ventricular systole. The first phase of ventricular systole is isovolumic contraction, and this isovolumic contraction is of 0.03 seconds. Valves are closed, and as the name suggests, isovolumic. Iso means same and volumic is volume. So volume is constant. So we can write here volume is constant. And this is contraction, isovolumic contraction. So ventricles are contracting because we are talking about ventricular systole, not atrial or something else. So ventricles contract. And since volume is constant, therefore pressure increases. And this elevated pressure leads to opening of semilunar valves. These semilunar valves indicate the aortic and pulmonary valves. Now the next stage is rapid ejection. See, ejection is of two types, rapid ejection and slow ejection. So first in ventricular systole, rapid ejection occurs and then slow ejection occurs. So first rapid and then slow ejection. In rapid ejection, 2/3 blood is ejected out, and in slow ejection, the remaining 1/3 blood is ejected out. Rapid and slow ejections together contribute 70 ml of blood, and this 70 ml of blood is the stroke volume. So, what is stroke volume? Stroke volume is nothing but the volume of blood pumped out by each ventricle in one cardiac cycle or in one heartbeat. Now, we'll discuss ESV. ESV stands for end systolic volume. Let's write down the definition of ESV. ESV is the volume of blood that remains in the ventricle at the end of systole. This ESV equals 50 ml of blood. Now let's discuss ventricular diastole that constitutes 0.5 seconds. Remember, this is diastole, that means relaxation. The first phase of ventricular diastole is protodiastole, and as the name suggests, it is the very primitive, very initial, very initial phase of ventricular diastole. This elevated pressure in the distended arteries tends to push the blood back in the ventricles. But we don't want this blood to reverse its direction back in the ventricles. So this is prevented by closure of semilunar valves. In the ventricular systole, it was isovolumic contraction, and this is isovolumic relaxation. Here, the valves are closed and relaxation occurs. And again, as the name suggests, iso means same and volume is volume. So, volume is constant. And since relaxation is occurring, therefore pressure is decreased, not increased, unlike isovolumic contraction. See, in isovolumic contraction, pressure was increased, but in isovolumic relaxation, pressure is decreased. Now, the next phase is rapid filling of ventricles. It constitutes the first 1/3 time of diastole. Okay, and maximum amount of blood is filled in this stage. That is rapid filling of ventricles. Maximum amount. Now, the next stage is slow filling of ventricles. This slow filling of ventricles is also known as diastasis. It constitutes the next 1/3, that is second 1/3 time of diastole, and in this stage less amount of blood is filled as compared to the rapid filling stage. Now the next stage is filling due to atrial contraction. This stage is also known as atrial kick. This stage constitutes the last, that is third 1/3 time of diastole. And see, this maximum and this less, these two constitute 80% of blood. So what about the remaining 20% of blood? Here, 20% remaining blood is filled in this stage. Now let's talk about EDV. This EDV stands for end diastolic volume. Let's define it. It is the volume of blood that remains in the ventricle at the end of diastole or relaxation. This EDV equals 120 ml of blood. Now let's discuss heart sounds. There are 4 heart sounds: S1, S2, S3 and S4. The S1 is lub and it is due to the closure of EV valve. Its pitch is low and the duration of S1 is longer as compared to the S2 heart sound. Now S2. S2 is dub and it is due to the closure of semilunar valves. The pitch is higher as compared to that of S1, while the duration of S2 is less. Duration is less as compared to S1. Now the third heart sound, that is S3, is due to the third phase of ventricular diastole, that is rapid filling phase of ventricles, of course. Let's write also third phase of ventricular diastole. See, S3 occurs in the normal physiological conditions only, not in the case of anomalies or something else. Like it can be heard in children, in pregnant women, and also during exercise. And last, S4. S4 is due to the forceful contraction of the atria. It occurs in pathological conditions, not physiologically. So, the most common pathological condition in which S4 heart sound can be heard is ventricular stiffness. That is due to restrictive cardiomyopathy and prolonged hypertension. So, it is heard in pathological conditions only. S3 is physiological and S4 is pathological. Okay. Remember the causes: ventricular stiffness and restrictive myopathy and hypertension. Now let's get back to the diagram so that I can summarize everything in a single diagram. See, this yellow portion is ventricular contraction or ventricular systole. And this is the very initial phase of ventricular contraction, that is isovolumic contraction. This is rapid ejection phase, and the next phase is slow ejection phase. Again, this yellow one is ventricular contraction, and this remaining portion is ventricular diastole or ventricular relaxation. This is the most initial phase, that is protodiastole. Then this is isovolumic relaxation. This is rapid filling phase. And the next one is slow filling phase. And then at last, this is filling due to atrial contraction. And that's the cardiac cycle made simple. And sorry for the background disturbances. So yeah, I'll see you in the next episode of MBBS in minutes. Until then, keep learning, keep growing. See ya.